Hello and welcome to my presentation on the Capstone Nursing Project, Diabetes Self-Management. In the United States, it is estimated that more than 30 million people are living with diabetes, which translates to 9.4% of the entire population. Out of the total number, 23.1 million people have already been diagnosed with the disease, while 7.2 million have undiagnosed diabetes. More importantly, 84.1 million people are at the risk of contracting diabetic conditions, and the numbers are projected to rise in the incoming years. Davis et al., 2018. The American Diabetes Association estimates that by 2050, 1 in every 3 people will be suffering from the condition if necessary measures are not implemented. In many cases, patients living with diabetes may develop other complications like depression, other lifestyle diseases, and heart diseases, which can lead to difficulty with self-care and the ability to adapt lifestyle behavior modifications. Beck et al., 2017. In every study, it is necessary to provide resources that are credible and reliable to provide evidence-based knowledge, which influences the current nursing practice. During the planning phase, I assessed the PubMed database, American Diabetes Association website, and the Centers for Disease Control and Prevention website to establish the prevalence of diabetes in the United States and the effectiveness of diabetes self-management. It is essential to note that PubMed consists of relevant, peer-reviewed journals, which are considered as the most credible source of information in the nursing study. Moreover, using peer-reviewed sources indicates that the references have been evaluated for quality and importance. However, both the ADA and the CDC website provided statistics which were essential in establishing the prevalence of diabetes in the country. During project planning, the Diabetes Self-Management Education and Support System was established as an effective intervention, efficient in promoting patients' health and reducing healthcare costs. In this aspect, Morgan et al. In 2018 indicated that the program is essential to enable the patients to control 95% of diabetes-related complications by making significant changes in their lifestyles. Furthermore, this was supported by the ADA, which indicated that patients are provided with education, knowledge, and skills that promote health by effective management of their care. Ratner, Davis, Loca, Willie, and Walls in 2017. During the implementation phase, the provision of this intervention to Lucy provided the same results. In this aspect, the literature was credible, which was supported by results from real practice. The reduction of costs was another aspect that was projected from the planning stage and was evident by the implementation stage. A report by the ADA indicates that DSMES is cost-effective by reducing the number of hospital admission and readmissions. This aspect is achieved through adopting measures such as adherence to medications, physical activities, eating healthy, and monitoring of clinical parameters. From this perspective, Orley D. Library Lima et al. In 2017 indicates that the prevention of various complications related to diabetes helps in saving almost $10,037 per patient annually. As a result, engaging in physical activities does not only improve patients' health, but it also helps in easing our healthcare budget. Furthermore, research conducted by Powers et al. In 2017 indicates that critical parameters in diabetes self-management are essential in preventing factors that could lead to deterioration of the patient's outcomes. Furthermore, emphasis on adherence to medications helps preventing readmission to the hospital, hence addressing the related costs. As such, coherence between different resources informed the study about the relevance of the literature to the study, providing useful information and statistics which were confirmed during the actual implementation. Advancement in technology has been one of the significant boosts in healthcare sector, especially in diabetes self-management. Mobile phones needed to be essential for clear communication between the patient and the interprofessional team. When providing care to Lucy, it was necessary to use a communication channel that was most effective to the patient. In most cases, When Lucy needed to see the doctor, she just called to book the appointment. Moreover, during various assessments carried out by the nurse, mobile phones were effective in providing feedback to the whole team. As a result, the interprofessional team adopted effective interventions such as medications, patient education, and patients counseling, leading to desired outcomes. Hunt, 2015. More importantly, Lucy's interest in learning about diabetes was importantly in establishing goals for self-care. In most cases, she used the device to access quality educational materials and motivational support. Since Lucy was forgetful in taking medications, she used the mobile phone to set notifications for medication and physical activities. As such, Lucy was enabled to manage her health, leading to improved outcomes. Furthermore, the utilization of automated bolus calculators, ABCs, in assessing the level of premeal insulin dosing was essential in diabetes self-management. More importantly, the use of ABCs in mobile phone applications and glucose monitoring results in the improvement of glucose control improvements, especially in patients with diabetes on insulin treatment, by preventing the fear of hypoglycemia and supporting patients with low numerical skills. Influences of organizational and government policies on planning and implementation of the project. For effective implementation of DSMES, Diabetes Self-Management Education and Support Standards, DSMS are required to achieve or surpass the training principles provided by the Medicare Diabetes Self-Management Training. However, it is essential to note that these standards do not assure reimbursement. More importantly, Medicare covers the initial 10 hours of DSMT, 1 hour of personal training, and 9 hours for getting group training, provided by Wilth, Walker, Smalls, Hill, and Edge, 2016. In exceptional circumstances, Medicare may cover up to 2 hours of follow-up training annually. In this case, it was essential to advise Lucy to get services more often than Medicare covered. Alternatively, the recommendation of services that are not covered by Medicare, which help in establishing the cost of these services and whether she could afford them. Often, Lucy was unable to finance the patient's counseling services, which made her rely on the interprofessional team's advice. The standards overseeing the DSMES significantly affect the delivery of the patient's services, which requires adherence to the standards for effective patient care. Standard 5 is an example of the standard that determined the composition of the interprofessional team. It is required that one member of the interprofessional team be a registered nurse, one dietitian, or pharmacist. However, the composition of more healthcare professionals is beneficial in providing expert census and applications of specializing clinical knowledge. As such, members cannot offer DSMES services without the right certifications, and any services beyond the range of DSMES providers. Practical procedures and processes are needed to ensure the participants are referred to suitable and medical specialists. Throughout the project, it was evident that the prevalence of diabetes in the United States need evidence-based interventions for effective patient care. The application of the patient-centered model, PCC, in delivering healthcare services seek to empower the patients, leading to an increased rate of medical adherence, leading to improved outcomes. Ratner et al., 2017, indicates that poor medication and diabetes self-management occurs due to insufficient consultations between patients and healthcare providers, resulting in worse glycemic control outcomes. Therefore, this project has provided me with the skills and knowledge on focusing on the patient during nursing practice, having a considerable impact on the patient outcomes. More importantly, it helps in maintaining and enhancing therapeutic relationships aligned with the personal values in decision-making. As such, the principles of non-maleficence, autonomy, and justice was well observed to improve patients' experience. In most cases, patients trust medical professionals with their health. Still, it is recommended for the patient to get involved in the decision of the medication and the process of the care provisions. Furthermore, the most important component of this project was developing an intervention that can be used by diabetic patients. DSMES is an effective program that provides effective results in enhancing the patient's safety and reducing the overall patient's medical costs. The observation of various clinical parameters such as blood pressure, blood glucose level, and overall cholesterol level prevents not only diabetes-related complications, but also enhances a healthy life. In this aspect, the skills obtained during this project will be pivotal in helping diabetic patients in my practice, either as a primary or secondary provider. Thank you.